rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hello, everyone. Today I saw a patient who recently underwent surgery for a gastrointestinal stromal tumor. He asked, "Doctor, how risky is my GIST based on the pathology?" Rather than making assumptions, let's take a closer look. Our patient is a 61-year-old man with a confirmed localized GIST that has been completely resected. The tumor measures 7 centimeters, with a mitotic count of 2 per historical 50 high-power fields. There was no tumor rupture, and the specimen was obtained before systemic treatment. Let's assess his risk using the original NIH-Fletcher GIST Risk Criteria calculator in the OncoToolkit. The original NIH-Fletcher criteria classify GIST into historical risk groups using 2 pathology features: tumor size and mitotic count. Let's enter our patient's information. First, enter the greatest tumor dimension. His tumor measures 7 centimeters, so we'll enter 7. Next, enter the mitotic count per historical 50 high-power fields. His mitotic count is 2 per 50 HPF, so we'll enter 2. Now click Calculate Score. Here are the results. This patient is classified as intermediate risk under the original 2002 NIH-Fletcher criteria. This is a historical size and mitosis risk group. Importantly, it is not an individualized recurrence probability, a tumor stage, or a treatment recommendation. Let's look at how this result was calculated. The calculator combines a tumor size of 7 centimeters with a mitotic count of 2 per 50 HPF. This combination places the patient in the intermediate risk group. Notice that this model does not use the primary tumor site as a scoring factor and does not calculate AFIP/meitner recurrence frequencies. For convenience, you can copy the result directly. You can also enter the patient's name and save the assessment within the platform. Previously saved assessments can be viewed from the Saved Results panel. If you'd like to learn more, scroll down to the reference data below for additional guidance and supporting evidence. The table shows how tumor size and mitotic count are used to define the original NIH-Fletcher risk groups. This model is intended for confirmed, localized, resected adult GIST without tumor rupture, using an untreated specimen and a mitotic count explicitly reported per historical 50 HPF. For this patient, a 7 centimeter tumor with 2 mitoses per 50 HPF results in an intermediate risk classification. This provides a useful historical risk category, but it should not be interpreted as an individualized recurrence estimate or treatment recommendation. For more oncology calculators and clinical decision support tools, explore the OncoToolkit.